Hello, everyone. This is Francine Crawford, and I am your host of Ornament Here. And I'm so glad to have again with me Mr. Frank Polanco from MJHS, and he's here to help us to clarify some things about Medicaid and Medicare and different things like that. And these are questions that people have asked us, and we're just going to find the information to give it to the audience. So please welcome Mr. Polanco to the show.
Thank you, Francine. It's a pleasure to be back on your show and do the best I can to answer the questions that your community has about Medicaid or Medicare Advantage. As you mentioned, my name is Frank Polanco. I'm the Senior Vice President of Growth for MJHS. It's a little different than before. I was mostly all my years been in charge of the health plan. My responsibilities have expanded a little bit more to include hospice and palliative and home care. I'm just learning about all those things. So don't ask me any questions about that just yet. But but as far as Medicare Advantage and Medicaid, I'll do the best I can to give you as much information as possible. And again, I'm happy to be here with you and the community.
Awesome. Well, that's great because these are questions that I could not answer. So I'm sure that there's something that you can help with answering this or getting some information out there. So let's just start with people were saying that they are being denied Medicaid because they have family support. Now, how does that hurt your qualifications for obtaining Medicaid?
I mean, Medicaid has, income levels, and I'll give you an example. For an individual, a single individual, their monthly income cannot exceed $1,752 or $31,000 approximately a year. These numbers change every year. So, I mean, if you ask me again in January, it might be a little different. And for instance, a married couple, the income level is $2,300 and change, and assets can exceed $42,000. So when Medicaid considers your eligibility, they take household income into consideration. So although the person applying for Medicaid might have income that fits the criteria, the entire household's income is considered by the state. So that's how someone's application might be affected if others in the household have higher earnings.
Oh, okay. So it's a household income.
Yes.
Okay. All right. So are you familiar with spend down program? Because people have asking about that. How does that work, spend down program?
So I just mentioned to you that there are limits. We said that the individual limit was $1,752. Now let's just keep it real simple. Let's say your income is $1,952 and you're over by $200. The state of New York will allow you to spend down those $200. So you'll cut the state a check every month for $200 so that you could have your Medicaid. And if you're enrolled in a managed care plan, like let's say Home First managed long-term care plan, we will bill you those $200 so that you can keep your Medicaid active.
Oh, okay. So you actually have to pay them the extra. Is that what?
Yes, you have to pay down. That's why they use the term spend down. You have to spend it down, pay that $200 or whatever the difference is between what your income is and the Medicaid eligibility limit.
Okay. So let's say if you can't get Medicaid, can you get a managed care plan? Does that work in that way?
Yeah, so you should think about it that there's Medicaid managed care and then there's Medicare managed care. And, Medicare managed care is typically Medicare Advantage, which is Elder Plan. Elder Plan is a Medicare Advantage plan. And, typically, Medicare Advantage is the alternative to traditional Medicare. And if you just had traditional Medicare, Medicare would cover basically 80% of your cost. You would be responsible for 20%. You would also be responsible for some premiums. You'd be responsible for some deductibles. Now, depending on the Medicare Advantage plan that you choose, some of those deductibles and some of those premiums may go away. Every plan is different, but the idea is that instead of where Medicare only covers 80%, a Medicare Advantage plan might give you the kind of like the peace of mind of knowing that you have specific copays. Maybe you have a $0 copay for a PCP. Maybe you have a $40 copay for a specialist. Instead of being responsible for 20%, you'd be responsible for a defined copay that you can budget and manage. And also, there's certain benefits that traditional Medicare does not cover, like dental, vision, hearing, and Medicare Advantage plans typically cover those benefits. And they also sometimes have transportation or have OTC. So if you do not have Medicaid, which would cover that 20% for you, it does make sense to check out a Medicare Advantage plan like Elder Plan, where you have multiple different products that might make sense for you, help you save money, and provide you some additional services that you wouldn't have had.
Okay, okay. So do you know if Medicaid or Medicare covers meals? And if not, are there any programs that do cover meals for seniors and elderly?
There are a lot of places in the community where seniors can get meals, but yes, Medicaid does typically cover meals. And I'm sure you've heard of Meals on Wheels or God's Love We Deliver. There are a lot of services out there that do work with Medicaid to provide meals for seniors. So typically, yes, Medicaid does cover meals.
Okay, okay. And there are other programs out there.
Yes, there are a lot of programs besides, you know, God's Love We Deliver, and like I said, Meals on Wheels are good examples. You'll find that in at least in the communities that we service here in the five boroughs of New York City, there's a lot of opportunities in senior centers where meals are typically provided on a daily basis. So there's really no reason why a senior should go without eating these days.
Okay. Does Medicare pay for or Medicaid pay for home care? And can you use Medicare to help with home care?
Well, let's start by the last part of your question, which is Medicare does not cover long-term home care. It does
Medicare?
cover short-term. Medicare does not. Medicare does not. It covers short term. After you get at a hospital, for 90 days, Medicare will cover some home care, some certified home care, but it's really not a part of the Medicare benefit. But it is a part of the Medicaid benefit. So yes, Medicaid does cover home care. It does cover a home attendant. So if you qualify for full Medicaid and you require long-term care to stay at home in the community, yes, it is covered by New York State Medicaid.
Okay. And who decides like if you qualify for home care? And how do they do that? Do you know how that happens and who decides that? Is it something that it's a rule as far as the federal government, or is it individual, with different organizations?
It really comes down to an assessment, and it gets a little complicated, a UAS assessment, but a senior citizen or anybody who, it doesn't have to be a senior citizen, anybody who requires long-term care to stay safely in their home could join. They need to have full Medicaid, and most of the folks that require home care like that are assigned to can choose or assigned to a managed long-term care plan like Home First. So basically, if we receive a referral from somebody who needs home care, and the first thing that happens is that the state conducts an assessment to determine eligibility. Once the state determines that the person is eligible, then the health plan goes out and does their own assessment and provides a plan of care. So yes, Medicaid does pay for it, but not everyone is eligible. So the state determines eligibility, then the plan comes out and does an assessment, and the plan then determines what the plan of care is, which, how many hours the person will receive and so on.
Okay, so if you are denied, is there how do you challenge that, or can you challenge that? Is there a period of time that you can challenge it, or can you challenge it at all?
There's an appeal. If you are denied, you could appeal. If you come onto the program and you feel like you don't have enough hours, you have the opportunity to appeal that also. And you appeal to the plan. The plan could deny or grant your appeal, and if they deny your appeal, you can appeal again, and you can go to in front of a judge, and they'll do a fair hearing. So yes, there's an appeal process.
Oh, okay, well that's good to know. That's good to know. Are you familiar with the NHTD program and the guidelines, the nursing home transition waiver?
Yes, the NHTD program is a Medicaid waiver program, and it's another way to receive home care. Traditionally, people who are in this NHTD program require a lot of home care, like live-ins or split shifts, and it is managed by the state, and it's the last resort before you would go into a nursing home, but it's managed. Yes, it's managed by the state. It's not part of the managed long-term care plans. It usually provides 24-hour care, really for the sickest in the community.
Okay, is that just New York State or is it all over?
Well, it is a New York State waiver program. I mean,
Oh,
it's possible that other states, have similar programs. Medicaid is very individual by state. They have different, levels, different programs. So when we're talking about this NHTD program, at least when I'm talking about the NHTD program, I'm talking about New York State's version of it.
okay. So as far as who runs these things and who says what the qualifications are, is it the federal government that has one regulation for all states, or do states have leeway to make some of their rules?
When it comes to Medicaid, the states make their rules. I mean, the states fund a portion of the Medicaid program, and the federal government funds the other portion. But each state's Medicaid program is individual to the state. So what you might be accustomed to in New York will be very different in the state of Florida or the state of Texas. The programs that are available, the services, the levels will all vary from state to state. As far as Medicare goes, Medicare is the federal government's health insurance plan, and those rules are the same regardless of the state that you're in. So, whether you pay the premium for A, pay the premium for B, when you're eligible, it's all the same regardless of what state you're in when it comes to Medicare.
Okay, that's good information. Okay, so let me ask you, if you are a veteran, is there different benefits or more benefits or something else that people don't know if they're veterans to look into that may help them?
I mean, the veterans have their own set of benefits. The veterans are able to go to the VA, and they're able to access their benefits at the VA. Active duty has TRICARE. So, they're a whole separate set of benefits that are available, to people who are veterans, the VA. Now, typically you can access all your VA benefits at the VA and join a Medicare Advantage plan like Elder Plan, and it really just supplements your benefits. Now, there are some active duty service members or people who have TRICARE who need to be very careful and probably should not enroll in a Medicare Advantage plan because it might affect some of their other benefits. But normally, a retired veteran, a normal guy out in the community who served, could still go to the doctor at the VA if that's what they want to do, enroll in a Medicare Advantage plan, benefit from all those additional services that they might receive. So they have the opportunity to really get both. So it's for a veteran, it works. They could. It might make sense for them to investigate a Medicare Advantage plan. They might have additional services that they'll be happy with.
Okay. Well, thank you. These are questions that people are asking. I know it goes all over the place, but there's sometimes when you have Medicaid or Medicare or whatever, and your needs change, and you may need to know what other support is out there, or if there is something else, a program for you because your needs have changed. So thank you so much for this. And also, is there anything else that you would like to add to this?
The one thing that I would add is that we talk about Medicaid, and Medicaid obviously is very, very important. But I would also say for those, seniors, that there are two other programs, and we probably shouldn't go into detail about the two programs, but there are two programs that maybe we could touch on next time. And one is the low income subsidy, which is a federal program that helps with the cost of prescription drugs. And the other one is the Medicare Savings Program, which is run by New York State Medicaid, which helps people with the cost of Medicare cost sharing. So, and those are two very important programs. People qualify for them based on income and assets, and it really does help with out-of-pocket costs associated with drugs or with healthcare. So I know Medicaid is the big one, and I know we always talk about care at home and home attendance. I know that's very, very important, but once you get beyond that, there's still other opportunities for seniors for lower income seniors to get help with some of the out-of-pocket costs. And maybe that's something we could touch on next time. I like a little teaser.
Well, thank you. Thank you. We love having you, Frank. You give us so much information, and we appreciate MJHS for all their services and what they've done. And congratulations on your new responsibilities. And you have to let us know how that goes. Maybe there's something else you can add to this.
I hope so. I think the idea, Francine, is that we can kind of bring together the synergies from the years of experience on the managed care side and help in other parts of the organization. So I'm looking forward to it, and I hope that it could just add more content to our future conversations.
Absolutely. Absolutely. Well, thank you so much for sitting here and giving us information on Autumn Here. So I'm hoping that, people will listen, and now things will be a little bit more clearer for them as they go through this process.
And just remember, Francine, and for your community, these things change often. So we might be having this conversation next year, and there'll be different information. So this stuff is fluid. It changes. It's a very complicated topic.
But it only changes in a year's period of time, right? Is it
correct?
right?
Correct.
Okay. So
correct. These amounts, these limits, they usually change every year.
Every year. Okay.
Yes.
All right. Well, thank you so much. I really appreciate it.
Thank you.
Okay.
And you have a great one.
You too.
Bye-bye.
Bye-bye.